Hello, my name is Dr. Richard Roble. I've recently published a book entitled Theaters of Trauma. The reviews of this book have suggested that it is honest, direct, compassionate, and touching. In view of these comments, I would like to read to you a brief section from this book. It is entitled Body Therapy. Sally's hands were placed demurely in her lap, and mostly hidden in the folds of her skirt. She was a rather conventional-looking woman. Her flat black hair cut in a page boy, just a touch of eyeliner, glasses slightly out of date, and a bit uneven on her ever-so-light brown skin. She looked, sounded, and felt exhausted. And for these reasons, she had been diagnosed as suffering from chronic fatigue syndrome. Not only tired all the time, she felt her legs, particularly her thighs, were full of knotted muscles, sensitive even to the touch. She had been depressed for years, was on a hefty dose of antidepressant medication, and was referred to me by her therapist who, quote, knew there was something he was missing but didn't know what, close quote. Sally's voice was quiet, so quiet that even sitting close to her, with my hearing aids fully turned up, I could barely make out her words. As we began, Sally was to describe vague nightmares, where she would remember little but would awake with her body rigid, clenching her pillow tightly to her chest. Exploration of these feelings or even traces of memories from dreams offered little additional information. These dreams, nightmares, continued for months. Sally would acknowledge she was terrified of going to sleep and increasingly became as terrified of lying next to her lover, although there had been no sexual contact between them in years. During one session, after recounting such a night, Sally blurted out, "I'm scared I might have been abused." I couldn't bear it if I was. She then began to shiver uncontrollably, with even her lips turning a bluish hue. She was at that moment both reliving some highly tinged emotional experience and trying valiantly to deny it. In a soft voice and sitting forward in my chair, I offered, "We really don't know what all this might mean, or even if these dreams, and now your fear, are somehow linked. I suggest we take our time and not rush to any conclusions." These words seemed to calm her. For my part, I had supervised and heard too many therapists making a premature conclusion of sexual abuse on the basis of such symptoms. They then restricted their treatment to retrieving memories and having their patients relive the experience as if emotional release would be healing in and of itself. All too often the result was additional trauma or new trauma, this time at the hands of a helping professional. That turned patients into stone and against therapy, possibly forevermore. No, it was better, I thought, to wait and let Sally move at her pace and lead the way. I suspended my impressions until a later date. Sally talked, hesitantly at first, about current events in her life, a teenage son that didn't listen very well, conflict with a colleague at her school, saving and spending money. All the while, though, she was sitting more and more uncomfortably. As she rubbed her thighs, I noticed her knuckles and finger joints were beginning to swell. She would, on occasion, tell me her hands hurt, and maybe she was even arthritic, but never with complaint or fear. It was her simple report, as if describing the hands of another, that caught her attention. Sally sought a medical examination and was told that she did, in fact, have arthritis. Although not a physician, I was skeptical that this was indeed an accurate diagnosis. The onset was sudden, and I wondered if the dreams, holding the blanket for dear life, the tension in her thighs, and her chronic fatigue might all be related. Still thinking it was too soon to approach these symptoms in any interpretive way, I began to pay attention to my own body. I sensed physically that I needed to proceed with care. When I would begin to feel impatient or wish to engage her more directly, I noticed tightness in my stomach and back. It took me weeks to recognize the connection, that I was holding myself back, tightening and compressing my muscles, which were also restricting my breathing. I began to feel anxious on the days of Sally's appointments. We were communicating body to body, or brain to brain, as neuroanalysts might say. It wasn't for another 4 months that Sally described the same physical pain and accompanying anxiety. To help with our, quote, joint suffering, I began to speak of my experience. I told Sally my back felt tight, as if I had to move around in my chair to find a more comfortable position, but felt strangely restrained from doing so. I told her my vertebrae cracked when I moved. I wondered if she could hear it, because the sound was so loud to me. I also said, while I sat very still, that I would feel like there was a strong steel band being cinched tighter and tighter around my stomach. My outside and inside were being squeezed together. I offered no interpretation, nor inquired about Sally's experience. I spoke and she watched, silently, for weeks on end. Every now and again I would see her eyes well up with unshed tears, or her face redden or blanch, sometimes in succession. As we went on, I noticed I was having trouble squeezing my right hand and picking up my pen. There was no swelling in my joints, just stiffness. I tried to rid myself of this by opening and closing my hands. I told Sally about this, commenting I felt like I was losing my grip, and it would leave me worried and vulnerable about my strength. Only later, as I was preparing a presentation on trauma, did I realize I was interpreting some of Sally's symptoms using my body awareness, call it somatic countertransference if you will. At one point, rather unexpectedly, Sally told me she sometimes felt like what I described as my feelings. And as she listened, she had some memories she hadn't thought of in years. Again, hesitantly. She told me she believed her father would come into her room late at night when she was about 7, stand quietly at the foot of her bed, and when she feigned sleep by lying very still on her back, he would remove his pajama bottoms and stroke her vaginal area. In the telling to me, she realized his relations were shocking to her, and she felt nauseous. She told me, strangely perhaps, given my physical condition, I did not. Sally would begin to talk. The spell of silence and the shutting down of memory was then beginning to lift. We entered a phase of talk therapy that continues today. Sally's knuckles and frozen joints improved once I suggested acupuncture. The release of chi, energy, via this treatment offered her renewed vigor and flexibility. My own symptoms slowly dissipated. Was it because Sally felt less pain? Did my stenosis flare up and now calm down through my return to yoga? Was this all coincidence, maybe the allure of chance? I don't know the answers to these musings, but then again, I find questions and mystery much more interesting than answers anyhow. Thank you for listening.